Hi, I'm Dr. Rupert Suckling. I'm the Director of Public Health here in Doncaster. This week we're continuing to see our infection rate fall slowly from a high over the last 2 weeks of over 140 per 100,000 down to today 114.8 per 100,000 for the period the 27th to the 2nd of April. As you may have seen, Doncaster, along with a number of its neighbours, Barnsley, Rotherham and Wakefield, have had one of the highest rates in the country over recent weeks. This is in part due to the success of the lockdown in December and January, where the percentage of cases we saw in Doncaster with the Kent variant were in the order of 10 to 20%. However, since March and the easing of restrictions in March, we have now seen almost all of our cases in Doncaster become the Kent variant. As you are aware, the Kent variant is much more infectious, although fortunately doesn't appear to cause more serious disease. The fact that the rates are falling is good, but it's obviously not so good that we are in the national spotlight, and I would ask you to redouble your efforts to try and reduce the rates further. I am pleased to say, though, that the rates and the impact of COVID on our hospitals put us in a position where we can move into step 2 of the government's roadmap out of lockdown, and this starts on Monday, April the 12th. As part of this, there are a range of reopenings and easements for England, and these include the opening of all retail, personal care can reopen, outdoor hospitality venues and indoor leisure and sports facilities for individuals or household bubbles are available. You can find out more detail on the government's website. However, as I said, it's still critical that we follow the basics, hands, face and space, to ensure that our return to these activities that we've all missed are as safe as possible and don't cause a spike in our infection rates that we will regret. It's as vital as ever that we're sensible, we adhere to the guidance and don't jeopardise our health or the health of others. I've written to businesses to remind them this week of the guidance and to encourage a safe return, and you've all got a big part to play in that too. Next week we'll also see our schools return to education following the Easter holidays, and as we mentioned last week, we're still seeing a high prevalence of infection in our younger age group, so please do support our children and young people to follow the guidance. I've also written to parents and carers via schools re-emphasising the guidance and that testing in secondary age school children is important to identify those without symptoms and to help break the chain of infection. From today, regular twice weekly testing is available in England for anyone, and you can book this through home testing or through collecting kits, and there's more ways to find out about how to access these on our websites. Finally, you may have seen in the news the latest advice on the AstraZeneca vaccine and people under the age of 30 who will be offered other vaccines as a sensible precaution. Vaccinations are still an important tool in our COVID toolkit, so I'd encourage everyone to come forward to be vaccinated when you're invited. We still have some work to do to get our infection rates down, so please, as we enter the next steps, follow the guidance and consider those around you. But together I'm sure we can keep doing this for Doncaster, and have a good week everyone. Thank you.